Here's some good news on the medical certification front. Many pilots who have a history of attention deficit hyperactivity disorder, or ADHD, can now get their medical certificate right from their aviation medical examiner right there in the office without extensive, expensive medical tests and months-long reviews by the FAA.
AOPA keeps flying safe, accessible, and fun by protecting your freedom to fly. We are the most trusted one-stop resource for all things related to general aviation. Become an AOPA pilot today.
Gary Crump, director of the AOPA Pilot Information Center's Medical Certification Section, joins us today to explain what this new guidance means for pilots. Hi Gary, thanks for joining us.
Hey Alyssa, great to be with you. This is really good news, so yeah, I'm anxious and happy to share it with you.
Awesome. Well, previously, pilots who reported a history of ADHD on their medical certificate application had to go through a really time-consuming review process that included expensive testing, very thorough, extensive testing, and then the FAA had to review it, and it could take months or more before they would hear back about their medical. Now, Gary, what does this new guidance mean for pilots?
ADHD is a really complex learning disorder that has historically been regarded by aviation medical certification purposes as a behavioral health condition, even though it's a learning disorder. So if you talk to the clinical psychologist, they're going to make a distinction between a learning disorder and a psychiatric diagnosis. But the FAA has historically kind of considered it in the psychiatric health realm. And as a result of that, and as a result of some past accidents that involved many fatalities, the FAA is appropriately very deliberate and conservative in their approach to medically certificating pilots with that diagnosis. Not every person who presents with the symptoms or even has a clinical diagnosis of ADHD really necessarily has it. So prior to this policy change, the FAA kind of lumped everybody's situation into the same bucket, and if the airman applicant reported a history of ADHD or use of medications or any medical treatment for that in the past, the FAA sort of summarily put them through the ringer and made them do the full neurocognitive evaluations, a full review of their past medical records, pharmacy records, and usually they'd ask them for a personal statement regarding their own experiences with ADHD. So as a result of that, they're just on the sheer volume of cases that the FAA has seen over the past with ADHD pathology codes, they have gleaned a lot of knowledge about the disorder, and as a result, they have been able to tweak their policy somewhat, which, again, this is great news because it now places ADHD on more of a spectrum disorder, like I mentioned, and allows the FAA to review cases that are remote histories. Obviously, not every pilot with that history is going to qualify under the policy change because some of these folks really do have ADHD, and some of them really need to be on medications, and unfortunately, they're not going to be able to qualify for a medical certificate. So their new decision pathway consists of 2 tracks to medical certification. The new one, called the fast track, is the policy, as I explained. If someone has been completely symptom-free, maybe years ago they were diagnosed or had symptoms, they were on medications, and they discontinued and have been completely fine for the last greater than 4 years, the AME then has that discretion to actually issue the medical certificate in the office. Of course, as with any medical condition, the FAA has the final authority to review that medical history and that medical application after the fact.
So at a high level, what are the criteria that pilots must meet in order to get on that fast track that you mentioned earlier?
So if there has been no treatment at all for ADHD, which medications is primarily the treatment, and that's for any reason. They can't be on any stimulant drugs or traditional ADHD medications for the last 4 years. There have been no symptoms and no evidence of symptoms in the reports that would come from the clinical psychologist and the clinical neuropsychologist, and that's who these reports have to be presented by. There's been no instability in academic performance, in job performance, social functioning in the last 4 years, and there is no other history of any other psychiatric diagnoses or conditions. That's basically the criteria for the fast track. So it's pretty straightforward. The key there is that the reports and the evaluations have to be done by a clinical psychologist or clinical neuropsychologist.
Now, Gary, if pilots meet this criteria, should they just go directly to their aviation medical examiner, or do you recommend that they, for example, call you all, the medical experts in the Pilot Information Center, kind of go through their history, their paperwork, and that kind of stuff?
Absolutely. We are the only membership association that has a dedicated medical certification staff in our Pilot Information Center. This is what we do. So absolutely, and this applies to any medical condition. We encourage pilots, members, to give us a call, because this is what we do. We know for the most part what the drill is and what FAA is going to require. But anytime there's something new like this, there's going to be little tweaks as we manage the learning curve. But clearly, the guidance is outlined in the online guide for aviation medical examiners, so anybody can go out there and take a look at that form. But certainly, members should take advantage of their membership dues and give us a call if they have any questions. It's always best to provide all the information that's necessary right up front to avoid these long delays. And it's just, again, the most important thing is do your homework and know exactly what you need.
That's right. And AOPA members, it's an easy number to call. Just call 800-USA-AOPA, and you can get connected to a medical certification specialist. Now, Gary, this doesn't apply to everyone. And so for pilots who don't meet all the criteria for that fast track, what should they do? What do you recommend?
For them, the policy has not changed at all. They will still be deferred initially by the aviation medical examiner. The FAA will then follow up with a letter requesting all past treatment records, probably a list of the pharmacy records for the last few years. And we see that they do ask for a personal statement from the applicant, and that's an important thing that the FAA does look at, because there are sometimes circumstances that would be presented by a personal statement from the applicant that might shed a little bit more light on what's really going on. But those three things, if they have been taking any type of ADHD medications, they have to be off those medications for at least 90 days, and then they'll be required to undergo a urine drug screen just to make sure that there are no stimulant drugs in their system. At that time, the FAA is probably going to ask them for the neurocognitive assessment. There are circumstances where they might not do that after the initial case review, but generally speaking, anybody who doesn't meet the fast track criteria is ultimately going to be asked to provide that neurocognitive evaluation. And like you said, that's an expensive battery of tests that has to be administered by, again, a clinical psychologist or neuropsychologist. So that runs up the tab pretty significantly, with no guarantee that a medical will be issued after the fact. But two distinct processes, and but again, for a lot of people that now fall under the fast track, it's just going to be a game changer for them.
Now, I know this move doesn't help everyone, particularly those who are currently being treated for ADHD, but what does this move signal from the FAA?
There's been a lot of change here. Alyssa, I'll tell you that policy within the FAA, and aeromedical policy, I think really is somewhat dependent on who's the federal air surgeon at the time. A lot of the policy is based on the federal air surgeon's viewpoints, also based on the recommendations from experts both within the FAA and outside the FAA with the specialty consultants that the FAA uses on a frequent basis. But a lot of this with our new federal air surgeon, Dr. Northrup, she is an active pilot herself. Her deputy, Dr. Wyrick, is also holds a pilot certificate, and it shows when the federal air surgeon, the top chief medical officer for the FAA, holds a pilot certificate. That person speaks airplane, is what we refer to it in the industry. They get it. They're pilots themselves. They understand it. So obviously the FAA is constantly trying to balance the mandate for safety against the opportunities to provide as many people as possible the opportunity to fly.
Thanks, Gary. Any additional advice that you have before pilots go to their aviation medical examiner, or if they are working through the medical certification process currently?
It's easy. Call us. The first thing, and this is guidance that you'll hear from people within the FAA, the docs. If people go to Sun and Fun or to Oshkosh, they go over to the FAA hangar. Probably the docs are going to tell them, do your homework first, understand what your condition is, and then find out what we're going to need in order to make a medical certification decision. This is what we do at AOPA. We are probably one of the best sources. Pilots can talk to their AMEs, but this is what we do on a daily basis. So if we can't figure out what you're going to need, then we'll find out for you. But certainly for AOPA membership, this is a great benefit, and so many members do take advantage of us. So give us a call first. We'll talk about your case. We'll tell you exactly what's going to happen, the timelines for it, what the FAA is going to require, and in most cases, we say all the time, in the vast majority of cases, the FAA eventually is able to find a way to get to yes, and that's their objective. They got to keep the airspace safe, but they want to get a yes for as many pilots that apply for a medical as possible. It's bureaucratic, it's time-consuming, it's frustrating, and it sometimes is kind of costly, but if you're motivated and you're persistent and you really want to fly, the chances are really pretty good that eventually you're going to get there.
Well, thank you, Gary, and all of our medical certification specialists in the Pilot Information Center for what you do every day to keep our pilots with their medical certificates flying in the left seat.
Thanks, Alyssa. Appreciate talking with you.
AOPA has advocated for a practical, reasonable approach to medical certification for years, and that includes ADHD reform and things like basic med. Now, more than 80,000 pilots have qualified to fly under the basic med program since it launched in 2017. Now, of course, the FAA is going to continue to update and refine its medical certification process. We keep pushing for more reforms. Please like and subscribe to stay up to date on all our latest videos, and we'll be able to bring you the latest on any other certification changes that come along.